Thank you, Mr. Massa. Dr. McBride, you are recognized for your 5-minute statement.
Good afternoon, Chairman Joyce, Ranking Member Clark, and members of the committee. My name is Dr. Maureen McBride, and I am the CEO of UNOS. I am a PhD biostatistician, and I have spent my career working to ensure more Americans are able to receive the gift of life. Thank you for inviting me to be here today. Organ donation and transplant is also my life's work. It's personal to me and my colleagues at UNOS, many of whom have been touched by organ donation or transplant. We go to work every day to support a system that is safe, fair, and effective for both donors and patients. We do that in a very specific way by supporting the nation's Organ Procurement and Transplant Network, or OPTN, under contract with HRSA. Our work to support the OPTN includes managing the national transplant waitlist and organ matching system, providing support to the OPTN volunteers during policy development and compliance oversight processes, and collecting and maintaining OPTN data on behalf of HRSA. I'm incredibly proud that every day more than 100 life-saving transplants occur through the national network that UNOS supports, and that our organization has played a role in giving more than 1 million Americans a second chance at life. To lead UNOS is to be reminded every day of the connection between life and death. Every transplant is a second chance, and some are born from tragedy, a life cut short, a loved one gone. I've heard countless stories that broke my heart, and stories that remind me of the true power of giving. Consider the experience of one of my colleagues at UNOS, whose father passed away in 2023 at the age of 54. Walking alongside him to the operating room during his honor walk was the most difficult moment of her life. And yet, she willingly shares his story to inspire others to become organ donors. Generous people like her father enabled more than 48,000 transplants last year. I also get to celebrate the milestones of other colleagues who are transplant recipients. They work at UNOS because they feel compelled by their personal journey and our mission. They are living full lives thanks to the immeasurable gift of more time. It's important to understand that UNOS is only one stakeholder in a very complex system, and when it comes to our support of the OPTN, we work at the direction of HRSA. As we have seen, the system is not perfect, and improvements do need to be made. The case in Kentucky shows that more work must be done to strengthen safeguards, promote patient safety reporting, and adopt more reforms. However, it's important to understand that UNOS had no direct role in the care ever provided to patients. We do not direct day-to-day operations at local hospitals. We do not work with families to secure organ donation or with hospitals to make donor referrals. We have no influence on patient care protocols, and we do not make determinations of death or direct medical decisions. But let me be clear, UNOS is here to work with all of you to make this system better. UNOS alone cannot make all the necessary changes to improve the system, but we are ready to collaborate. That's why today I call on Congress to require CMS and HRSA to work together to establish a no wrong door comprehensive patient safety reporting system. Any patient, family member, or health professional who has witnessed or experienced poor care should have a clear path for reporting their concerns. Since more than 95% of hospitals are not members of the OPTN, CMS and HRSA must work together to close the reporting gap. UNOS remains deeply committed to working with Congress, HRSA, CMS, and the community to ensure that the system is safe, fair, and effective. In addition to the no wrong door reporting system, I recommend 3 more reforms: implementing automated deceased donor referrals, mandating a national tracking system for donor organs, and migrating the OPTN computer system to the cloud. I've outlined these and other reforms in my written testimony. I did not become CEO to maintain the status quo. The organ and transplant system is founded on trust. To continue to earn and keep that trust, we must work collaboratively to improve the system that serves as a beacon of hope for patients and families across America. Thank you.